Opportunity to testify. I loved serving on this budget committee in the last session. I miss this committee, and I have great respect for the task in front of you. I'm here to share my thoughts and the ideas of my constituents in Wyoming about the fiscal challenges facing our country. I've been listening to Wyoming's common sense-minded people, everywhere from the feed store to the grocery store. They want Congress and the President to put America on a path to fiscal stability by halting this country's spending spree and tackling our long-term debt problem. But the President's 2012 budget proposal would have the taxpayers shell out $844 billion in annual interest on our debt by the next decade, over triple what we pay currently. That's an unacceptable projection, and we need to make reforms now to change course. This is no longer a fiscal issue, it's a moral issue. I'm a member of the House Appropriations Committee, and I've had the opportunity to help reduce our discretionary spending, but discretionary spending alone will not get our country on sound fiscal footing. Discretionary spending accounts for less than 40% of our government's budget. In fact, if you take away defense spending and mandatory spending, that only leaves 12% that's non-defense discretionary and non-mandatory spending. So I'm here today to stress the urgency of tackling entitlements in the 112th Congress. Medicare, Medicaid, and Social Security will eventually collapse under their own weight if they're left unchanged. We must address this unsustainable entitlement issue if we're to preserve entitlements for future generations. The chairman of this committee, Mr. Ryan, is no stranger to ideas for reforming entitlements. I support his roadmap for America's future, and I look forward to seeing many of its provisions in the House budget for FY 2012. For example, proposals to raise the Social Security retirement age for younger generations have received backing from leaders in both parties. I've heard Steny Hoyer discuss it. I've heard John Boehner discuss it. And the roadmap has recognized the need for this change, and the National Commission on Fiscal Responsibility and Reform included it in their final report. Now, that is why I have introduced a standalone bill to increase the retirement age for today's 4-year-olds by 3 years, from the current law of 67 to age 70. It would not affect anyone in their 50s, 60s, 70s, 80s, 90s, or 100s. It only affects people 49 and younger. It's H.R. 867. It's called Alex's Law, named after a 4-year-old child of a member of my staff. This is a common sense approach to help save Social Security for future generations. It's necessary because the life expectancy after 65 for today's retirees compared to 1940 is 5 years longer. We all know that the Social Security Trust Fund will be exhausted by 2037, which means every retiree will see a 22% cut in benefits, and the cuts will continue to get worse if Washington looks the other way. So my bill is just a first step. It only closes between 1/3 and 1/2 of the Social Security shortfall. But changing the retirement age is a gradual adjustment. We will not begin to see the full effects of this reform for decades. It comes in the out years. But it's still the most common sense and well understood reform, one that seems to have generated the most bipartisan support, and it's a starting point for a more comprehensive package to make the program solvent. I also want to talk a little bit about Medicaid. We need to work with states, and specifically the nation's governors, to cap or limit the federal financial commitment to Medicaid, and in exchange give states the flexibility to manage their Medicaid programs as they see fit. By capping and then block granting the federal dollars to the states that are actually running Medicaid, we can return the decision of how best to run these programs to the states, their elected officials, and the citizens to which they are accountable. And we will learn best practices from the states. They will be the incubators, the laboratories for great ideas. A state-centered Medicaid program could provide better care for beneficiaries at lower costs. In Wyoming, we absolutely know that. Because we have the smallest population in the nation, we were able to survey 100% of children on Medicaid. And we compared and analyzed claims data under both Medicaid and Blue Cross Blue Shield, and found that it was more than twice as expensive to cover children under Medicaid than Blue Cross Blue Shield, and almost 1.5 times more expensive to cover adults. But state Medicaid programs are currently at the mercy of a bureaucracy that disallows them from trying alternative coverage mechanisms, including a health savings account type of arrangement for the uninsured. And that is under development by the state of Wyoming using entirely state dollars. Entitlement programs, along with other mandatory spending, consume roughly 60% of the federal budget. We can't afford to continue ignoring their importance in our fiscal future. Appropriations bills and discretionary spending have been the first focus, and we've done that in the last number of weeks. But in order to really get at the problem of our fiscal trajectory, we must provide that same platform for entitlements. We must have the debate in committees, on the House floor, on the Senate floor, if we're to find solutions for our future safety net. The fiscal year 2012 budget is the opportunity to bring these entitlement reforms to the budget. Mr. Chairman, I deeply appreciate the opportunity to appear before you today. I can assure you, America's ready for this discussion, and they're demanding that we put politics aside in the interests of our nation. I look forward to working with all members of this committee, both sides of the aisle, to address this crisis situation.
Well, thank you, Ms. Lummis, for testifying here today and representing Wyoming so ably, and I look forward to working with you and every member of this committee and this Congress. Thank you so very much for your testimony today.